Malaria, a life-threatening disease, has plagued humanity for centuries. It continues to cast a long shadow over global health, particularly in tropical and subtropical regions. The World Health Organization estimates hundreds of millions are infected each year, with many fatalities among young children in sub-Saharan Africa. Malaria's presence underscores the need for research, prevention, and treatment. The Plasmodium parasite, transmitted by Anopheles mosquitoes, is the true culprit. Malaria is caused by the Plasmodium parasite, transmitted through the bite of infected Anopheles mosquitoes. Plasmodium falciparum is the most prevalent and deadliest species. Anopheles mosquitoes breed in stagnant water sources. The female mosquito transmits the parasite during blood feeding. Inside the body, the parasite multiplies in the liver and invades red blood cells. Early diagnosis and treatment are crucial to prevent severe complications. The journey of the Plasmodium parasite within the human body is a complex and fascinating process. After entering the bloodstream through the mosquito's bite, the parasite travels to the liver, where it undergoes a period of rapid multiplication. Following the exoerythrocytic stage, the parasites, now in a different form called merozoites, are released from the liver and invade red blood cells. This cyclical process is responsible for the characteristic fever and chills associated with malaria. The rupture of red blood cells releases toxins into the bloodstream, triggering the body's immune response and leading to the characteristic symptoms of malaria. These symptoms typically include fever, chills, headache, muscle aches, and fatigue. Prompt diagnosis and treatment are crucial for preventing severe complications. The symptoms of malaria can vary depending on the species of Plasmodium causing the infection. But some common signs include fever, chills, headache, muscle aches, and fatigue. These symptoms typically appear within 7 to 30 days after being bitten by an infected mosquito. Recognizing these symptoms early is crucial for prompt diagnosis and treatment. The characteristic fever associated with malaria often follows a cyclical pattern, with periods of intense chills followed by high fever and then sweating. This cyclical pattern corresponds to the rupture of infected red blood cells and the release of parasites into the bloodstream. In severe cases, malaria can lead to life-threatening complications such as organ failure, coma, and death. Children with malaria may exhibit additional symptoms, including severe anemia, respiratory distress, and convulsions. If you experience any of these symptoms after traveling to or residing in a malaria endemic area, it is essential to seek medical attention immediately. Treatment for malaria typically involves anti-malarial medications such as artemisinin-based combination therapies or ACTs. These medications are highly effective in clearing the parasite from the bloodstream and preventing further complications. The choice of medication and the duration of treatment depend on various factors, including the species of Plasmodium causing the infection, the severity of the illness, and the patient's age and health status. Early diagnosis and treatment are crucial for preventing severe complications and ensuring a full recovery. In addition to anti-malarial medications, supportive care may be necessary to manage symptoms such as fever, dehydration, and anemia. This may include intravenous fluids, antipyretics, and blood transfusions in severe cases. The emergence of drug-resistant strains of Plasmodium underscores the importance of continued research and development of new anti-malarial drugs. Continued innovation is crucial in the fight against malaria. Preventing malaria involves a multi-pronged approach, focusing on reducing exposure to mosquito bites and controlling mosquito populations. One of the most effective prevention methods is the use of insecticide-treated bed nets, or ITNs. Sleeping under an ITN creates a physical barrier against mosquitoes, and the insecticides further reduce the risk of transmission. Another effective prevention strategy is the use of insect repellents containing DEET. Applying DEET to exposed skin can significantly reduce mosquito bites. Other preventive measures include wearing long-sleeved clothing and pants, especially during peak mosquito activity periods, typically dawn and dusk. Mosquito control efforts play a crucial role in reducing malaria transmission, involving eliminating mosquito breeding sites and using larvicides. By taking proactive steps to protect ourselves from mosquito bites and supporting mosquito control initiatives, we can significantly reduce the burden of this devastating disease.